Liposuction is it's a commonly requested procedure. The key thing with liposuction, it is not an operation to lose weight. If you've got certain fatty deposits and you know you're slightly overweight, you're much better off losing weight naturally, because your body will lose weight all over and you'll maintain a proportion, and you'll always get better results with natural weight loss than with liposuction. But for some people, despite the fact they lose weight or they can't lose weight, they've got stubborn deposits of fat that they wish to have re-sculpted into a slightly different shape, and that's where liposuction comes in. I'll say liposuction is quite a painful operation. It's painful during the procedure and it's painful after the procedure. My advice generally is you're better off going to sleep for liposuction, and then once the patient's asleep, a small rod is used via tiny little incisions, maybe 2 or 3 per site that you're doing liposuction on, and the fat is sucked out. It's important to try and suck the fat from the deeper layers so that you maintain a nice smooth layer of fat on the surface, so you don't get bumps and dents and irregularities. However, if you're just sucking fat from an area, the skin needs to retract, or else you'll be left with an empty fold of skin. Sometimes the skin's not good enough to retract, in which case you can then do superficial liposculpture, but with a much narrower needle, and suck just underneath the surface of the skin and take an even amount everywhere so there's no irregularity, and that scarring underneath the skin tightens the skin back up, and that's probably the best way of achieving a bit of skin retraction afterwards. The complications of liposuction tend to be few and far between, but the skin over the surface where the liposuction's been can go numb afterwards. You can get some irregular pigmentation, which is transient, and that normally settles after several months. You can get lumpiness underneath the skin due to little collections of fluid or little hard areas, but that normally settles with time. It needs a bit of moisturisation and massage before that will go flat. Probably the worst complication after liposuction is oversuction, so you get dents in the skin. It used to be said that once you've got the dents, there's nothing you can do to put the fat back, but we're now aware that we can do fat transfer. So if somebody does end up with significant denting afterwards, you don't have to live like that, but it's a much more involved procedure to transfer fat back into those areas, and you're much better off not oversucking the fat. So the careful surgeon will always rather undersuck an area than oversuck an area, and is wise to be aware of that limitation before deciding on proceeding with a liposuction.